I'm Dr. Caliendo from Nurture Wellbeing Chiropractic in Stony Brook, and this is Dr. Olga, a holistic dentist from Green Lawn. We decided to come together today to talk about why holistic dentistry is really important, and as our patients know, it's something that we recommend to everybody because everyone needs to have a nice gentle dentist that can really work with the body as naturally as possible. So Dr. Olga, thank you so much for letting us interview you.
Welcome.
Thank
you for coming.
Thank you. Can you tell us a little about the dentistry that you and your colleagues do?
Certainly. So our practice mainly focuses on minimally invasive and conservative dentistry. That could be taken in so many different directions, right? But the main goal, we want to prevent root canals and crowns. And with more information coming out about how toxic those things may be, I think this is the only way that I would want dentistry in my mouth, and the same thing I like to provide to my patients.
Dr. Olga, so you practice a very unique style of dentistry called biomimetic dentistry. What exactly is biomimetic dentistry?
Excellent question. So biomimetic means bio is nature and mimetic is to mimic or to be like. So it's a nature-like dentistry. And how can we make nature-like dentistry? So the key is to pretty much mimic the natural tooth as much as possible, but obviously not using tooth materials. We do have to use synthetic materials. And there are different types of materials that mimic the density of the tooth. Let's say the outside of the tooth is enamel, and it's the strongest material in the body, even stronger than bone. Do you know that? So the inside of the tooth is dentin, and it's very flexible and malleable and gives in when we chew, because we put a lot of pressure on our teeth when we chew. I think it's up to 300 pounds. That's why a lot of people have TMJ issues, and if they're grinding at night. So the key for biomimetic dentists is to try to mimic the inside of the tooth and try to mimic the outside of the tooth. So those are two different materials, and this is what's done in layering. That's why the procedure may take a little bit longer than a regular filling. So each layer has to be placed in the proper orientation of the tooth, so this way it feels like a natural tooth. Not only looks like a natural tooth, we do have some pictures here where we can see some of the big amalgam fillings were taken out and replaced with the white filling, which is common, but to make it feel and look like a natural tooth is the key of biomimetic dentistry.
And Dr. Olga, where does ozone, I know that you use ozone when you are mimicking, when you're when you actually do create a brand new tooth really from substances similar to those made in nature. But how do you use ozone with that, and why would you use ozone?
So ozone is great for disinfecting the mouth. So ozone is pretty much 3 oxygens together, so it's a highly powerful antioxidant, and we use it for all the dental cleaning. So any time you would do any type of dentistry beforehand, it would be ideal to get your teeth clean. So all the water we use is ozonated. It also goes through all the lines and the handpieces. So we use the ozonated water throughout. And if the tooth had a really badly decayed area, we can ozonate it with water and gas, and that would pretty much cut down the bacteria versus removing it physically and getting close to the nerve and the pulp. So there's multiple ways of using ozone, and we're trying to utilize all of them.
That's amazing, and it's chemical free. It's just oxygen that's really cleaning and disinfecting the body to create a really great environment for a nice healthy tooth to now live in. So Dr. Olga, I was looking at your website and I saw that biomimetic dentistry could actually prevent root canals. How is that possible?
Well, this is the main reason why I got into this whole dentistry. I can tell you a little bit about where I'm coming from. This way we have a good idea why I'm doing what I'm doing. So I practiced general dentistry for about 10 years, and I saw how, some of my dentistry, my colleagues, I was just losing faith in what I was doing because I saw how many redos, how many teeth lead to root canals, and it just seemed like something wasn't done right or maybe done well. So when I started the research of a better type of dentistry, that's something that caught my eye, that biomimetic dentistry able to prevent root canals, and I would never have a root canal in my mouth. Although I did end up with some because the way I didn't know about certain things and I had my amalgam replaced, and I did end up with a few root canals. So back to your question, the way it's done is we have to realize that by removing decay close to the nerve, we basically compromising the nerve. So the biomedical dentistry came up with certain steps, what you can do to prevent. So there are certain areas you have to remove the decay, and that could be like a little pinhole or 2 millimeter area near the nerve that you can actually leave a little bit of decay. And that is able to remineralize if it's fully sealed by the proper materials, which that's the self-healing mechanism of our bodies.
Wow.
And this is just mind-blowing. That's like nature mimicking and minimally invasive, like all together. And by doing it this way, so it obviously has to be done slow. Again, the procedure may take a couple hours. Sometimes we're doing multiple visits if patients don't feel comfortable. But if you know your goal is to prevent the tooth from root canal, you would take any kind of time and precautions for this to happen.
That's incredible, because what we found with root canals is that root canals are lethal. When you really look at the research and the studies that tell you what happens in the body after a root canal, cancers, major illness, major disease occurs after having a root canal. So getting the opportunity to be able to have the tooth heal, to save the nerve, to save the tooth in this way, is so worth it, because it saves. Prevention's always better than cure. So, Dr. Olga, there are very specific ways that you remove amalgams in your office. Why is that, and what are the precautions that you take to make sure that amalgams or mercury fillings are removed in the safest way possible?
Excellent question. So this is very important, because you can remove amalgams pretty much anywhere, probably, and you can get a white filling, and it might even look the same. But again, coming from personal experience, I had that done in my mouth, and I had my amalgams replaced. The dentist didn't do anything wrong, but we're simply not taught how to do it properly, let's say going for dental school, and how to refill the tooth properly by traditional training. So when that was done to me, I ended up with root canals and a crown. And I would never want that to happen to anyone else, because obviously we don't want those things in my mouth, in our mouth. So how do we take it out properly? So we do follow a protocol, which is called IOMT protocol, and anyone can visit the website. It's called International Academy of Oral Medicine and Toxicology, which is like an opposite branch of ADA, and they did start together back in the day, and they split. So ADA believes in fluoride and amalgam, and IOMT believes in taking amalgams out and not using fluoride. So these are two separate academies, and they adhere to different dentists. So we follow the protocol, and we'll go through how it's done in the room, where we put the rubber dam, and we use the oxygen mask. This way there's no vapors from the removal being inhaled by the patient and the doctor, so we also protect ourselves. And once the amalgam is properly removed and disposed, there is steps with swashing with charcoal. This way, if there's any particles leaked around, that helps to get absorbed as well. And then we do have the chlorella protocol afterwards, and and then of course you do your magic with the detox, which is obviously the most important part once you get them out. So then once the amalgam is removed, there's options of how to replace it, right? You can't walk around with a hole in your mouth.
Mm-hmm.
And one way is in traditional dentistry, and that's what I was doing before I learned about the biomimetic dentistry, is doing a crown. Because again, some of these fillings are so big that a lot of times the dentist would tell you it's too big to be filled with the white filling, which is, I don't want to say it's not true, but there is a way to fill it with the white filling, but you just have to follow the certain steps that it will work. Because the white fillings are totally different material than metal, and metal is very rigid and it tends to crack teeth, and that's why a lot of times again they'll tell you need a crown because your tooth is cracking because the metal is cracking your tooth. So there is still a way to save a tooth without a crown, and this is what the whole point of biomimetic dentistry, it almost could be related to no tooth deserve a crown type of dentistry. Like you don't want to cut the tooth for a crown because imagine this is the filling that's going to be removed. So now you have a hole here, and the rest of the good tooth structure all around has to be removed to accommodate for a crown. So you're left with pretty much nothing, just to have the tooth capped like this and sort of being told that it prevents it from fracture, but in your mind, you know it's totally not, doesn't make any sense, right? Like you can't prevent the tooth by removing more tooth from fracture.
Wow.
So it's very rewarding, and it does work because it's based on science. There's multiple research done in Italy and in Japan and even in US, of course, that shows this type of dentistry works, and it has been working. So we just need to get more people aware that it's out there and it's available.
Yeah. Thank you.